I'm going to overview the options that people have for the natural treatment of hypothyroidism. Usually what happens is people go to their doctor, they're told they have hypothyroidism, they're given a prescription for levothyroxine or Synthroid and told to take it for life, and otherwise just don't worry about it. But of course people do go on to worry about it. They want to know why they have hypothyroidism. Why do they have to take this medication the rest of their life? What does this mean about their health? And is there something else that they can do about it? One of the more annoying things people tell me is that their doctor diagnosed them with hypothyroidism. But that's not very specific. There are multiple causes of hypothyroidism, and we can see this in the labs. There can be a low TSH pattern, low iodine, autoimmune. Of course, some people might have their thyroid surgically removed, which is a bit of a side topic. I'll just mention that if you're in this category and still are not feeling well, you should still pay attention to the rest of the video because there's information that can be relevant for you. First, we'll go over a low TSH pattern. So TSH, or thyroid stimulating hormone, is made by the hypothalamus and pituitary glands, which are at the bottom of the brain. So when the brain senses that you don't have enough thyroid hormone, it secretes the TSH, and TSH goes to the thyroid and tells the thyroid to make more thyroid hormone. If for some reason the brain is not making much TSH, you can have low TSH, and then that can cause you to have low thyroid hormone. So you'd see on the lab test, low TSH around 1, maybe less, maybe slightly more, but low or low normal thyroid hormone levels T3 and T4, and you won't have antibodies. In holistic health, we want to respect the body and work with it, not fight against it. If your brain is making less TSH, that means something in your body is saying, I don't want a lot of energy. I don't want to push things too hard. If you have a low TSH pattern, you really don't want to take thyroid hormone replacement, and I don't care how many websites or supposed experts or integrative doctors there are who are ready to prescribe these people thyroid hormone. It's fighting against your body, it's not going to make you feel well, and then what happens is those people end up in my office telling me the story about how they were told they're hypothyroid, they were given medication, and it made them so sick. With low TSH, we want to consider why the body is slowing down. Toxicity, chronic infections, weakened immune system, there might be issues with other hormones, cortisol, estradiol, emotional stress, nutrition. We can basically go through all the major categories, but this requires a holistic assessment to see what's going on in the rest of your body. You fix the other thing and the thyroid is going to get better. We can also have a low iodine pattern. With this one, the labs can look like the low TSH pattern because TSH could be low, or TSH could be high. You can see it go either way. We're going to have low T3 and T4, but also the antibodies are going to be normal as well. And this is simply someone needs more iodine. Sometimes they need selenium as a co-nutrient, vitamin C at times also. There are different ways practitioners may test for iodine. There are urine iodine tests out there. In my office, I just do applied kinesiology muscle tests to see how people respond to iodine. And by also looking at other symptoms, I have a good idea. Breast pain, women with PMS or issues with ovaries, there's a good chance that they need iodine. And then we have the more common form, which is autoimmune or Hashimoto's. In this one, we're going to see elevated TSH with elevated antibodies. And the antibody test is thyroid peroxidase and thyroglobulin. There are two of them. And medical doctors often need to be told to test these. You know, a lot of times they're just not interested in testing it. They'll just run TSH or maybe one of the thyroid hormones to be like, okay, you're hypothyroid. Here, take some medication for life. But you really need to have the antibodies run to first of all diagnose you specifically with autoimmune thyroiditis or not, and then if you're going through a natural treatment plan, it's going to help later on to know if you're getting better or worse, because if you're getting better, your antibodies will go down. If you're getting worse, those antibodies are going to increase. Key points about autoimmune thyroid disease: this is the one where the body does not have enough thyroid hormone and the thyroid is not capable of making enough of it. So people will respond to thyroid hormone medications. This could be Synthroid, levothyroxine, Naturopathic, Armor. I'm not saying someone is going to respond equally to all of those, but this is a condition where someone will respond to it. And even if you want to work on this naturally, you do still want to take some type of thyroid hormone replacement, because if you can't make enough thyroid hormone and your body keeps on putting in more TSH to try to get more going, that's going to just contribute to the inflammatory problem going on with the thyroid. There are multiple triggers with autoimmune disease in general: chronic infections, toxicity, leaky gut through the whole molecular mimicry process, allergies. There are other triggers as well. It's a big topic, so I'm not going to go through all of it now. There might be some people online who act like it's as simple, like if you have Hashimoto's, then you must have a leaky gut, or you must have gluten sensitivity. Now, those things are problems with regards to Hashimoto's, and they are triggers. But it's too simple to say there's only one trigger, there's only one thing. We have to look at the whole body in terms of health, whether it's gut health, diet, allergies, but also detoxification, nutrient status, emotions, any type of structural physical trauma, even that can lead to this. So you really need to look at everything. You can't just be like, I'm going to remove gluten and I'll be fine. So the big question that people have once they're diagnosed or aware of a problem with their thyroid is what to do about it. If you are diagnosed with hypothyroidism and are given a Synthroid prescription, or maybe one of the other thyroid medications, and feel better on it, then you could simply just take Synthroid and forget about it. Now, there still will be an underlying issue that led to your autoimmune disease. Now, if someone gets one autoimmune disease in their life, they're more likely to get others. So the underlying issue over time can present as something else, and people won't necessarily even make the connection. For example, rheumatoid arthritis is related to poor gut health. So maybe early in life someone gets a thyroid issue and later on they get arthritis, but if their gut health was fine, they wouldn't get either. Or there could be something else going on, such as a metal toxicity. So if you take Synthroid and forget about it, you can feel fine in the short term because now you have thyroid hormone, but there might be some underlying issue going on. If you feel okay without being on thyroid medication, but there's something going on with your labs, then a lot of times the medical doctors play this game of watchful waiting, which means you just come in every 6 months or a year. They retest your thyroid labs and they wait until it's bad enough to give you medication. In this case, you want to take preventative action. If you're developing an autoimmune disease, then it is much easier to take action now and get healthy so it doesn't continue rather than reverse it. Because once those antibodies go up, they can come down. You could reverse it, but it takes a long time and it takes more work. Some people are diagnosed with hypothyroidism, they're prescribed medication, and it doesn't work for them. For these people, they can't simply, Synthroid and forget about it, even if that's what their medical doctor tells them to do. Often, these people have a low TSH pattern. They should not have been prescribed Synthroid or whatever thyroid medication to begin with. Sometimes they might be misdiagnosed as having Hashimoto's when they really don't. And at times they come into my office and they're frustrated because they think that they need a different form of thyroid hormone, when in fact they don't need thyroid hormone at all. They need to fix the underlying reason why their body doesn't want a lot of thyroid hormone. Their body is slowing down because of some other stress. Now, other times people do have Hashimoto's and they're not responding to the medication at all, even though they need some type of medication. They might need a different form, or there might be other factors interfering in the usage of the medication. So poor liver function can interfere in conversion of T4 to T3. Excess estrogen can interfere in your body's usage of thyroid hormone, as can adrenal issues. So those are just 3 examples. So usually what I do is work on people on overall health and get them healthier, and the healthier they are, then the better use their body's going to make of that medication. Of course, long-term, ideally, you want to see people off the medication without an autoimmune disease, but that's would not be expected to happen in 1, 2, or 3 months. And if someone is saying that that's typical, that they're going to turn around that fast, then I really don't think that's being very honest. Depending upon what state you're in, you could go to a naturopathic doctor who sort of does everything for you, because in states like Washington or Arizona or Vermont, naturopathic doctors are licensed to prescribe medication. So they can run all the thyroid lab tests for you. They could prescribe medication if that's needed, and ideally they would also work on the underlying health issues that are causing hypothyroidism as well. In the state where I am in New York, I do not have a license to prescribe thyroid medication or run the blood work, so I end up being the person that someone goes to for the natural treatment side of it, whereas they usually will then have someone else to run thyroid hormone labs and prescribe the medication. I find that when people come in with hypothyroidism and they don't feel well on treatment, there's a lot of confusion because their medical doctor is clearly not giving them complete information or the right treatment. But then online, there's so many different people saying so many different things, whether they're saying everyone needs iodine, or everyone needs to remove gluten because they have gluten sensitivity, or everyone needs this form of thyroid hormone because Synthroid doesn't work. And people really don't know what to think anymore because you have so many experts coming at them from so many different sides. To me, the main thing is being a holistic practitioner and not having an agenda. I mean, if I want to make a website about gluten sensitivity, I can put up information about how gluten sensitivity leads to autoimmune disease. But again, just because you have an autoimmune disease doesn't mean removing gluten is going to fix you. And it doesn't mean that that's the cause of your hypothyroidism. And I'm honestly kind of sick of seeing a lot of very simple, watered down information, almost propaganda being put out by people in the natural health field, simply because it's much easier to dumb everything down and put out one-sided information and saying everyone, hey, if you have this symptom, then you need to do this, even though that's completely contradictory towards holistic health. Holistic health means you're looking at the whole person, not just their thyroid, and you're looking at them as an individual. And if you do that, it shouldn't be hard to figure out exactly what's going on with these different thyroid conditions and why some people respond to medication and other people don't. And it shouldn't be hard to figure out what to do about it. And people shouldn't have to go around suffering for months or years with ineffective treatments that leave them with hypothyroidism or something else at times. And just being told that it's nothing, or being told to do the same simple health tips that don't necessarily work for them. If you like this video and want to see a follow-up on different medications and supplements that can be used for thyroid hormone replacement, then just go to this video. Otherwise, that's it for now. Bye.